Good afternoon, everybody. I'm Donald Clark. I'm one of the acupuncturists here at CNY Healing Arts, CNY Fertility. How are you today? It has been a good week here in Central New York. It's finally starting to dry out a little bit, and we're finally starting to get some sun. So maybe we will end up getting a really nice fall. That's the goal here: having a nice fall, normal weather. None of this crazy weather that we've been having. The final statistics are in, and we had the second wettest summer in history here in Central New York. And we also had the warmest August in history in Central New York. So it was hot and muggy and damp. And that is a recipe for damp heat. And you don't want damp heat. So, we talked a little bit in the past about things that you can do to prevent the dampness and the heat from occurring. So I hope you've been implementing that. And I'm sorry for my tardiness today. It's another very busy day today. And but here I am. And I wanted to talk a little bit on a subject that, on an experience on a subject that's hard to talk about. And that's the loss of a pregnancy or a miscarriage. And but I'm gonna, I've come to find out, that it's one of the most common occurrences in the journey of building a family. And something, I've seen lots of different statistics, but the one that really caught my eye and was startling to me was the statistic of sometimes half of pregnancies end in a loss. And most of those come even before women know that they're pregnant. So the demise of the embryo happens so early that oftentimes you may not even know that you were pregnant. So, but other times it can go a little later and present some complications that we're going to talk about a little bit today, and try to make it as try to break it down, as clear as possible. And I hope I can lend some tips that help you through the process if you've experienced it, or if you're experiencing it, or if you're trying to start a family. So miscarriage. So it's defined as a pregnancy loss between 0 and 20 weeks. So anything under 20 weeks is a loss. Anything over 20 weeks is considered something completely separate. And there's different kinds of miscarriage, different kinds of loss, and some involve incomplete, what they call an incomplete miscarriage, and that's not necessarily the common miscarriage. Most miscarriages occur on their own, and they finish on their own. So it doesn't often require procedures or surgical procedures or medication to help assist in removing some of that tissue. So one of the instances in where you may need some treatment is if it's an incomplete miscarriage, and that may require some medications or a DNC, which is a bit of a surgical procedure. And so those are some simple, as I'm sure most of you know, some simple definitions of miscarriage. And one thing that we have to remember is that between 0 and 20 weeks, it's out of our hands, right? It's something that's out of our control. And mostly it is caused by a genetic abnormality. So this, Mother Nature is, she's beautiful and she's cruel, and she's beautiful, cruel, and you'll never meet another creature like it. But when there is a genetic abnormality, it's, to have the loss earlier is better, right? And so it's out of our control. It's not something that we choose or wish, but if there is a genetic abnormality, then the embryo will not go forward. It will not thrive. So then, hence, you have a miscarriage, and there's different ways to prevent that from happening, and there's different treatments, and we will get into that. Another statistic that I thought was amazing is that roughly 85% of the women that have suffered a loss go on to have very normal pregnancies. And so I think that's something that we need to consider and keep our heads up because there is there's a future, right? Loss is a horrible thing, and but we have to remember to keep going forward. It's not as common, there are instances where you have reoccurring loss, and that tends to be an antibody issue. Um, and so preventing inflammation is a big component of treating reoccurring loss, and we'll get into that a little bit too. And so remember, it's out of our hands, it's out of our control, and we just keep going. And I always tell everybody that I've worked with or that I have seen or treated, and it's true. If every follicle became an egg, became an embryo, became a creature on planet Earth, we would be overrun, right, with life. And a fish will literally lay 1,000 eggs, 1,000, but only 100 become fish, right? Only 100 become mature fish. So that's nature in its purest form, and when you're dealing on such numbers with retrieval and egg retrieval, and when we're dealing with such high numbers, you're going to have that scenario play out. Not all the time, definitely not all the time, but it can play out. And if we keep our minds open and understand that there is going to be some good, some bad, some in the middle, then and just remember, keep going forward. Don't stop. And we'll talk a little bit about that. So some of the symptoms of possible miscarriage are some of the obvious ones, some spotting or bleeding early in the pregnancy. If you're going through one pad an hour or more than one pad an hour with blood flow, then consult your doctor immediately, in regards to it. Some of the other symptoms that you may occur are cramping, right? Back pain, abdominal pain. That's very common. Sometimes on the onset, you'll get some white, foamy mucus discharge. So be aware of that. And if you ever have a fever with these symptoms, then that needs to be addressed immediately. So that's an immediate phone call to your physician or urgent care. Anytime you have a fever with symptoms like that, you're risking a larger infection, and that's not a good idea. So those are some of the symptoms, that you may experience. Another symptom is a, an intense feeling of loss, right, of grief, and so pay attention, to how you're feeling, and keep yourself dialed in. Now, you can have slight spotting, right, and some slight bleeding in your first trimester, and it can be something completely separate, right? Something that's not as threatening or dangerous as loss. So it could be, a tear. It could be the endometrium expanding. It could be a tear. It could be lots of things, and that doesn't necessarily mean things are going to break bad, right? So you have to kind of differentiate between the two, and that's why that's why it's important to give a call and just ask these questions. There are several causes for loss and miscarriage. There's obvious ones, right? There's the obvious ones of tobacco use and alcohol use and drug use, right? Like rule that right out. But you can also have there's some adult onset conditions or diseases that can cause or lean towards loss, and diabetes is one, right? Thyroid conditions, making sure that you keep your thyroid levels um, normal and stable is really important, as well as your blood sugar levels, right? You want to keep your blood sugar levels stable and normal, because once they start to fluctuate, they can put a lot of pressure on a pregnancy, especially early on. So, this goes back to trying to make sure that we keep ourselves as healthy as possible, keep our nest, as healthy as possible. And there's another component that is not necessarily common, but it can happen, and that's a cervical insufficiency, right? So sometimes the cervix has a really hard time staying closed. It has a really hard time um, maintaining and holding that pregnancy. So there's a simple technique called cerclage, right? It's termed cerclage, and what that does, it essentially stitches close the cervix. I believe I have that correct, and that's another thing. So if you have a weakened cervix, that can cause reoccurring loss, and also RH. Um, yeah, the RH negative can also um, cause inflammation, which attacks the cells, right? And so you want a healthy pregnancy. You don't want antibodies um, attacking cells, right? So you want high antioxidant diet, as well as keto diet, and we'll get into that in the uh, prevention area. That I I will at after we get through some of this, I will go through and talk a little bit about the Chinese medicine component. In Chinese medicine, there's so many things that we do to prevent loss. Like once you're pregnant and you're in your first trimester, all of our attention's on that, right? I mean, we devote so much energy to starting the family and getting you pregnant. But once you're pregnant, then it's like really we're focusing in and we're dialing in even more as to how you're feeling and what's going on. And so, exhaustion is a component that can cause loss, right? And so what happens when you're exhausted, your energy levels or your chi levels are so low that your body's freaking out, right? So it's saying, "Oh my God, I'm hanging in there, but I'm so deficient and so tired that I, my body can't support a pregnancy." So it's so important to keep your energy high, right? Keep your chi levels high, keep your blood levels strong, keep your blood nourished, and that's if you have, right. I mean, lots of things can cause loss. Trauma, blunt trauma, or a fall, but even severe anemia, right, or in Chinese medicine, blood deficiency. If your blood isn't strong, that can cause a loss, right? So you have to have strong fundamentals, energy, and blood to carry a baby to term. So those in regards to Chinese medicine, those are some of the things that can cause miscarriage. Um, Prevention, right? There's a lot we can do for prevention. Um, we talked about keeping your TSH levels and your blood sugar levels stable and normal. Dr. Kiltz really strongly encourages a keto diet, right? It's 80% fat, 20% protein. And so, in regards to that, the idea is to prevent inflammation. So, inflammation is one of the primary problems with reoccurring miscarriages. And so, you know, Kiltz's keto in is great for that, right? So a keto diet, right? A paleo diet, eliminate gluten, eliminate sugars, eliminate the grains and the nuts, stuff that's going to cause inflammation. Now, this is if you are okay with this diet, right? This is okay. This is if you are not a vegetarian, right? So if this diet works for you, I do encourage you to take this diet and take it to heart and take it to earnest, especially if you have reoccurring loss. It's been proven time and time again to help with that. And you know, try to eat lots of antioxidant or keep your antioxidants high, right? Folic acid, vitamin D, um, eat well, right? Don't work 100 hours a week. We talked about exhaustion and blood deficiency. You want to keep your iron levels high, right? You want to make sure you're taking a prenatal. Um, you don't want to have blood deficiency or anemia. Yoga, downtime. When you're pregnant, it's important to just slow down a little bit, right? It's easy just to kind of keep blasting through our work week. But if you're tired going into it, you're going to be tired in it, and you're going to be way tired after it. So you're after the pregnancy. So it's important to slow down. So give yourself some rest, right? You have to charge your batteries. You have to keep yourself strong. You have to keep yourself charged, right? You have to keep yourself nourished, right? Keep your chi levels high, keep your blood levels strong. Those are really important. Again, gluten free, right? It's important. Try to avoid exercise. I don't, and there's conflicting um, opinions on that. I don't recommend. I don't recommend exercise. I don't. I think yoga and going for a walk, especially in nature, going for a hike, a moderate hike, no heavy backpacking, is great, right? Walking your dog, playing with your children, going for walks with friends. It's all very good. Um, I do not recommend heavy cardio or weight training, especially when you're pregnant, right? So it just sends the wrong signals to the body, the reproductive system, and the body in regards to what is going on in my environment, right? I understand that it helps a lot of people maintain their well-being, and if that is how it is for you, then great. Then you. I'm just going on some of my past experience that with exercise and pregnancy. Slow down, give yourself more time. Another thing that you can do is to prevent loss is simple. um, do some screening, right? If you're in the IVF process, you have the option to screen your eggs and genetically screen them to see what's going on, do some testing, and that can sometimes determine the viability. And so that's also another option. And keep your keep your nest healthy. Another component to loss and miscarriage is the is heat, right? We've talked about heat time and time again. Heat is not our friend. Sauna heat from the sun, that's different, right? But internal heat, energetic heat, is really bad for our bodies. As our bodies heat up inside, they can sometimes cause bleeding, right? And so we don't want that. So keep your heat levels down during your pregnancy, especially the first trimester. So eat those cooling foods like watermelon, right? Try to stay away from the foods that are very slippery and hot, like pears. Pears are very slippery, so stay away from those. We don't want lots of fluid, right? We don't want lots of lubrication. We want everything. We don't want it to be dry, but we don't want excess um, yin or excess moisture, right? So we want to keep our yang down, right? The heat. We want to keep our yin up, right? We want to keep our yin nourished, right? So keep that in mind. Watermelon takes the heat out. So you know, try to stay away from gingers and cinnamon, right? Those are all very warming foods. Moderation, a little ginger tea, right? My belly hurts. A little ginger tea, that's okay. But you see people that are, you know, ginger tea 2 or 3 times a day, every single day. Ginseng, same thing. All those are very powerful, very hot. Cinnamons, very hot, very powerful. And in the summer, it's not a good idea. In the winter, in the very cold months, then some warm foods and herbs are not such a bad idea. Um, so you know, try to do all that stuff, and that'll help prevent of the um, some of the environments that are conducive to loss, right? So try to do that, and so slow down. Try not to exercise too much. Be careful with what you eat. Um, keto, keto. It's going to help with inflammation, and that's the primary culprit in all of this, right? So, um, and if you don't do keto, that's fine. Just avoid those hot foods, and try to eat fresh and whole, and keep the rich antioxidant diet coming in. Treatment. So, you know, once the loss and miscarriage, once the threatened miscarriage has presented itself, you're kind of, at the mercy of the nature and of the situation. So you're just, slowing down, and you might want to take an extra vitamin or an extra iron supplement to help with the bleeding, and to help keep your blood levels high, because you're gonna keep going, and you're gonna try again to get pregnant, right? Some people recommend 1 month, some recommend 3 months. It's at your pace, right? So when you're ready, and acupuncture in the treatment component of all this can help a few ways. One, it can help strengthen your blood, nourish your blood, and gently move blood during the pregnancy, um, during the pregnancy itself. And when complications occur, we can continue to do that very gently, right? You don't want strong acupuncture at this point, because the body is vulnerable at this point, and it's very sensitive to energy and movement. So you go with gentle techniques, gentle treatment. If the miscarriage uh, progresses to the point where it is a miscarriage due to ultrasound, or some sort of lab test to determine that, be it blood or whatnot, then acupuncture is very good at helping move, right? Helping flush or helping move blood out one last time to ensure that it's as complete as possible. And if it's not complete, then there's procedures, medical techniques that will help with that. And so keep that in mind. So acupuncture is very good at that, in treating that, as well as building back up. So the idea is to build your core back up, build your energy back up, and build your blood levels back up, and build your heart back up. So in the idea of treating for the loss, it's the heart component is an important part of it too, because it's hard, right? You go through a loss, and it's a loss, so you're sad. and you have this overwhelming sense of loss. So it's very important to address that, and it's very important to strengthen your heart, your kidneys, and bring that back. And so that's really important. So if you've suffered from it or you're suffering from it, I do encourage you to get acupuncture. I do. I really do, because it helps so much in energetically bringing everything back to a healthy level, to so that you can start again. And and keep that in mind. Eating well, right? Eating well, giving yourself downtime, giving yourself quiet time. Um, it's really important in that process of treating and healing from it. Um, Yoga, right? Meditation, that all goes to downtime, right? So um, do those things. Do you just do it slower, and if you can incorporate some of that stuff into your lifestyles, it's all going to make a difference. And it's an issue that's really a topic, an issue that's really personal for a lot of people. And I hope I was able to maybe wade through it and bring some insight to it all. And in regards to Chinese medicine, it's important to treat um, during and after to bring you back to where you were, and we can do that. It's the one thing about the reproductive system is it's resilient, right? I mean, it is resilient, and it wants to procreate. So it's resilient. It responds very rapidly. So it's not as if, like, it's the end of the line, because it's not. We can continue moving forward, and you have to, right? You have to. So if you have questions, call me, okay? And if you on Wednesdays, I talk with people, and so you can set up an appointment to talk on Wednesday. All right, and I'd love to talk to you a little bit more about it, and maybe you can teach me a little bit about it. I'm just going to quickly look at some questions and go through them real quick, and maybe hopefully answer some for you. So here are my glasses, and they're not the old lady glasses. Let's see. Hi, Grace. Yeah, there's more just not necessarily questions, but conversation about loss, and some loss is more involved than other loss, right? It's all, at the end of the day, it's still a loss, and depending on what has happened to cause that, or what has happened in which um, they might think has caused that. Um, it's treatable, right? I mean, some stuff is beyond our control, right? The genetic abnormalities. Um, that's really, I'm not going to change your genetic coding, right, with acupuncture. I can help, right? I can help create a better nest, but I can't do much with the genetics on that. So some 90% of it is treatable or maneuverable, and the other 10% is not. But not all of, and that's where screening comes in, right? That's where the screening comes in. There's a question about pituitary issues, and I am not versed in that, but I would have to say, if there's some issues with the pituitary, then it's gonna radiate out into your body. So there's a chance that any kind of pituitary issue really has some implications on a pregnancy. Yeah. Breastfeeding. Yeah, well, breastfeeding, yeah, it's tricky, right? So, like, this, prolactin. You you shouldn't really be breastfeeding from what I understand during the next. Well, let me back up. Um, yeah, breastfeeding. It's tricky, and I'm going to pass on that one. But you're going to do you, but prolactin levels can mess with a pregnancy. There's a question about, sorry for the delay. There's a question about, and it's actually, that's a good question. It's a good concern. So the question is, I have a certain amount of embryos, not a lot, but a certain amount, and the fear is if they go into testing and they're deemed unviable, then I've lost those embryos. Yeah, that's a concern, and that's if you have reoccurring loss, then testing might be more important than if you don't have reoccurring loss, right? So I can tell you from from clinical experience here, I've seen so many day 3 embryos turn into babies, right? And healthy babies running around. So I don't know, there's a point in which we need to just kind of jump in and go for it. So if the need for screening isn't as high as maybe some other situations, then I guess I wouldn't, and I might just go for it. So the question is warm foods, right? So warm foods. I think there's some misconception on warm foods. Warm foods, basically, if you eat a raw diet, um, great, right? What When it comes to warm foods, the idea for me is that um, too much cold raw food can damage your stomach, your intestine, your ability to digest foods at a pace in which the body likes. So, but if you're eating raw foods and you're eating lots of cold foods, all you have to do is incorporate a little bit of warming food, right? Like ginger or cinnamon, just like we talked about. Um, and that'll warm it. Like that'll balance it out a little bit. So now you have inside it's warmer, right? So now it's digesting a little quicker. And or I do encourage you after eating a raw diet, have a cup of warm water, right? Have a cup of tangerine tea or orange tea or ginger tea. And what that's going to do is not only is it going to bring the stomach and the contents up to temperature a little bit, but it's going to help speed up the ability to break that food down. And all that what that does is it saves your energy, right? So it doesn't you don't expel or you don't use up more precious energy to digest that food than you have to. And so the idea here with keeping warm foods and cold foods separate, I don't think you really have to, but if you're eating a lot of cold raw foods, then you need to try to warm them a little bit, and that'll help. There's some questions about supplements and I'm not familiar with that. And when you know, um, the question is whether I should stay away from specific herbs and tinctures. And yes, no, it depends on the tincture, right? And it depends on the ingredients or the formulation of that that tincture or of that formula. In regards to this topic, there's definitely some stuff you should stay away from herbs in regards to tinctures, and we talked about those, right? But it all depends on the stage in which you're at, the level at which you're at, and the formula which is prescribed. So some are definitely better than others, and some are a no-no. And but uh, your herbalist or your acupuncturist is the one that's highly trained in that. So they're the ones that are going to be able to determine whether or not you should, be taking it or be on it. Um, so trust them; they're highly trained, and very rarely do they make mistakes. It's very rare, and often enough they're right on point. Bone broth, yeah, bone broth is a good idea too, especially for those keto people. They know the values of bone broth. So I know I've spoken of having guests on, and I'm still going there. I'm going to attempt to have embryology here next week. The only fly in the ointment is that depending on everyone's schedule, like their schedule is different than my schedule, and so trying to line them up is um, has been the difficult portion of all this. So I have talked to them, and they would love to come on and answer some of your questions and chit chat with you. And I'm going to shoot for next week. If I can't get them on, then we'll talk about something else. I hope this has all helped. Please email me or text me, and we'll chat a little bit more about it. And if there's anything I can do, just let me know. Have a great weekend. Have a good holiday weekend, you guys. Bye bye.